watching the News Hour at 9.
Welcome back, ladies and gentlemen. And India seems to be facing a COVID emergency of sorts, because in one single day, we've seen 1.68 new positive cases coming up, and just about 10 states account for 81% of the COVID positive cases in the country. And one state, Maharashtra, alone leads the pack with nearly a third of India's COVID positive cases. At a time like this, we've seen the government approving yet another vaccine, which is Sputnik, which is Russian origin. And to talk about this, I'm joined by Dr. Guleria, Director of the All India Institute of Medical Sciences. Also joining me tonight on the show is Dr. Hemant Thacker, Senior Consultant at the Breach Candy Hospital. Dr. Guleria, the first question is, the Sputnik clearance that has come in has been awaited for a long time, but when it's coming today has raised a few questions on whether this has been given emergency clearance, given the fact that there have been shortages of vaccines that have been reported from various parts of the country, and there is a clamor for vaccines for all. Many chief ministers asking for this, opposition leaders asking for this. How safe is the Sputnik vaccines? That's what our viewers would want to know from you firsthand tonight.
Firstly, the company Dr. Reddy's laboratory had applied for emergency use authorization for the Sputnik vaccine many weeks ago. I think almost 3 weeks ago, even before this controversy started. Secondly, there is now peer-reviewed data published in international journals, which have shown, or phase 3 trials which have been published, which show that this vaccine is safe. It has an efficacy of around 91%. And therefore, I think there is no doubt about the safety and the efficacy as far as global standards are concerned. The studies that were done were what we call bridging studies to see for safety in Indian population. And this data was presented to the regulatory authorities a few weeks ago. They have looked at it critically. They had asked for some clarification, which they've got. And based on that, the approval has come. So I think this is a great step forward. This will add on to the number of doses of vaccines that we need. But I don't think this is something that has been done in a hurry. It's been done following all the procedures, and there is global data that this is a safe and effective vaccine.
So, Dr. Guleria, my question would be, how soon would this be available in hospitals, and what are the productions? Will this solve our vaccine shortage issue, that the country is facing?
So the production and availability should happen within a few days, because I'm sure the company has already stockpiled doses which they could roll out and supply. But I don't think we can say that this itself will solve the whole problem of providing vaccination to vaccinate the entire country. We have a huge population, and even if you look at our adult population, it's around 97 crores, so it's about 1 billion people, and we need 2 billion doses. Now that is not going to be easy to get, and therefore we will need to really try and see how many more vaccines we can get. And I'm hopeful that in the coming weeks, more vaccine manufacturers will be able to provide vaccines in India. But we will have to have a graded response, because the demand is always going to be more than the supply for months to come.
So, Dr. Guleria, many states, including Maharashtra, are looking at lockdown as the only possible solution, because the numbers are spiraling out of control, and the new mutant variety that we've heard, is spreading a lot faster than the strain that we saw last year. Dr. Guleria, in your sense, do you think lockdown is an alternative, not just medically, but economically? We'll have to keep an eye on the economic issues as well. But do you think there are other measures other than lockdown that can be put in force in order to, meet with the challenge that we are currently facing?
So currently, we may not need a national-wide lockdown, but I do believe that it's every citizen's responsibility first to follow COVID-appropriate behavior. If we had been doing that for the last few weeks or months, we would not be in the situation where we are today. So if everyone was wearing a mask, if everyone had physical distancing, if we did not allow the crowds that we've seen happening in the last few weeks, or the parties and the marriages that have been happening with huge number of people, we would not have had this situation, because all of these are super spreading events. And like you said, if we have a mutant which is very infectious circulating in our country, this will lead to, the virus will spread like wildfire. And that is what has happened, that there's been a huge spike in the number of cases, and all healthcare facilities are getting really strained and we're running out of beds. Therefore, I would still appeal that we should really work on good COVID appropriate behavior. Every citizen should understand his responsibility. We need to have very aggressive surveillance, identify the hotspots, go back to our policy of red, yellow and green zones. Those which are red zones where there are a huge number of cases, here you could have a containment plan or a lockdown in that area, but a national-wide lockdown may not be a solution.
Well, Dr. Thacker, let me come across to you and let me ask you a Maharashtra issue, because, the buzz, the task force, the chief minister's meetings are all talking about the mulling of a lockdown, at least in Maharashtra. Do you think Maharashtra has no other options other than a lockdown? And do you think it's imperative to control the numbers? A lockdown must be imposed in Maharashtra at least?
So we had a strict lockdown on Saturday and Sunday, and our numbers have dropped on Monday. So I'm not saying we have a strict, complete lockdown, but I like Dr. Guleria's idea that I would want to enforce very strict disciplinary measures with marshals roaming on the street, fining people on the spot for not wearing masks, hounding people for gathering together, and for COVID inappropriate behavior. People should not be allowed out for the fun of just going out and mingling. Lockdown in its fullest form, which we had last year, may be detrimental to society, productivity, etc. But the situation which we have in Bombay is not a wave. We have a tidal wave. There is a crunch on beds, medicines, oxygen, sisters, nurses, ambulances everywhere. So the next 15 days are going to tell us which way we are going. So the citizens have to really help us, and the citizens do not have to fall prey to WhatsApp and to rumors, but they have to enforce strict discipline.
Very well said, Dr. Thacker. It's actually at the end of the day in our hands. And in the meanwhile, will authorities also look at the political rallies and the Kumbh Melas and other congregations? Clearly, it has to be our own reaction as citizens without waiting for authorities to take a call. The question is, next 15 days, definitely a challenge for India and definitely for the 10 states that make up 81% of the COVID positive cases. Ladies and gentlemen, the solution lies in our own hands. There is only so much in terms of infrastructure, in terms of vaccinations that are available, not just in India, but worldwide. At the end of the day, we have to follow our safety measures, which is COVID appropriate behavior, social distancing, don't go out, wear your mask, and stay away from crowded places. That's all I have for you, and thank you very much to the two doctors for joining me on the News Hour tonight. Good night, and I'll see you tomorrow. Same time, same channel, same show, the News Hour at 9.